Hey there, amazing parents and caregivers. Welcome back to our channel where we make parenting a little easier, one tip at a time. Today, we're diving into a topic that's close to every parent's heart: baby health and wellness. We'll cover some common problems your little one might face and share easy, practical solutions to help you navigate those tricky moments. So, let's get started. Babies are bundles of joy, but let's be real, they can also be bundles of worry, especially when they're not feeling their best. Here are some common issues you might encounter and how to handle them like a pro. First up, diaper rash. Almost every baby experiences it at some point. Red, irritated skin can make your little one super uncomfortable, but don't worry, here's what you can do. Change diapers frequently to keep the area clean and dry. Use a gentle, fragrance-free baby wipe or warm water with a soft cloth. Apply a thick layer of diaper cream with zinc oxide to create a protective barrier. Let your baby go diaper-free for a few minutes each day to let their skin breathe. Easy, right? Next up, teething. Those tiny teeth breaking through can make your baby fussy, drooly, and downright miserable. Here's how you can help. Give them a clean, chilled teething toy to chew on. Gently massage their gums with a clean finger. Offer cool, soft foods like yogurt or purees if they're eating solids. And if they're really uncomfortable, check with your pediatrician about using baby-safe pain relief. Sleep, the holy grail of parenting. If your baby is struggling to sleep, try these tips. Create a calming bedtime routine: bath, book, lullaby, and lights out. Swaddle your baby snugly, but not too tight, to mimic the cozy feeling of the womb. Keep the room dark and quiet, or use a white noise machine to block out distractions. And remember, it's okay if they don't sleep through the night right away. Every baby is different. Babies catch colds. It's just part of building their immune system. But here's how you can help them feel better. Use a saline spray and a bulb syringe to clear their stuffy nose. Keep them hydrated with breast milk, formula, or small sips of water if they're over 6 months. For fevers, dress them in light clothing and give them baby-safe fever reducers, but only after consulting your pediatrician. And of course, lots of cuddles and comfort go a long way. If you found these tips helpful, give this video a thumbs up and don't forget to subscribe for more parenting hacks and baby care advice. Share your own tips or questions in the comments below. We'd love to hear from you. Thanks for watching, and until next time, take care of yourself and your little one. Bye!